Now, moving on in this section of the neuropathies to the last section, and we'll be briefly going through the different pain syndromes. Especially, we'll be going through the fibromyalgias, chronic pain, regional pain syndromes, and myotonia. As you know, that the neuropathies, the most important symptom of neuropathy is pain. This could be very severe form of pain, sudden stabbing, shooting type of a pain may be there. There may be increased radiation of the pain as well. So we, in this section, we'll be briefly going through those pain syndromes which may be associated with neuropathy. So coming to the myotonia first, it is the inability to relax a muscle after end of voluntary contraction and effort. It is a prominent feature of certain genetic disorders. This includes dystrophic myotonia, which actually has two types, and it's autosomal dominant inheritance. Usually in adults, and muscle weakness and wasting is there, and they are unable to carry out their normal function because leading to clumsiness. There's ptosis and difficulty in chewing because once they contract their mouth, they cannot open it back. It may be associated with diabetes, there is cataracts and cardiovascular failure as well. The treatment option, as it's a genetic disorder and associated with genetic mutations, so treatment option is physiotherapy and orthotics devices so that they can to help these patients so that they can carry out the activities of daily living. Other form is myotonia congenita. It's also a rare autosomal dominant or recessive type of a disorder. It could be dominant as well as recessive. Muscle stiffness is common, usually walking and climbing problems are associated because they have gait disturbances, they cannot walk or properly as well. They may be associated with muscle cramps and weakness. The forearms, the calves are usually bulky because the muscles are weak, and usually there's associated are they actually the fat and infiltration is so much that the muscle is actually replaced by fat. And now coming on to the acute and chronic pain syndromes. As you know, the nerves are mostly the foremost symptoms of nerve injury is actually the pain. So acute pain, it could be due to it's usually associated with in case of a fight or flight mechanism. That is, for example, if somebody punches a hard area or hard wall, then definitely that would feel a pain in his or her hand. For example, if a person touches a very hot object, this suddenly definitely will not burning sensation and pain as well. This is usually associated in case of autonomic fight or flight mechanisms are associated with increased pulse rate and vasoconstriction, may be associated with rapid breathing and muscle tension. And usually treatment is actually splinting and elevating anxiety, analgesics, and removing the painful disorders. For example, if somebody gets a cut, skin due to a knife cut and an injury, that would definitely be associated with the pain and bleeding as well. So the initials usually, if the offending agent is removed, it eventually results in resolution of the pain. Chronic pain is actually that kind of dull aching pain which may be associated with some kind of a chronic disorders, a systemic disorders, and it may be present from months, maybe 3 months, 6 months, or even a year. It's kind of associated with degenerative and arthritic disorders. It may be a chronic pain of malignancy. The treatment option is actually initially symptomatic that you give NSAIDs and these so that pain threshold is reduced. But underlying cause is actually treated. If it's due to osteoarthritis, then we have to tailor our treatment for the osteoarthritis. Or if it's underlying due to malignancy, then we have to further work it up and so that the tumor can be removed in the body. And then along with the rehabilitation psychosocial programs are there so that the patient can have can come out of this chronic pain, but underlying issue has to be addressed so that the chronic pain can be alleviated forever. Now threshold could be, and it just depends upon the person. It, for example, the patient could be in a high amount of a pain but maybe saying okay, I have a moderate amount of pain, and in some cases the patient may be have a very less degree of pain but he or she may be crying of the pain. So that pain threshold varies from person to person, and it needs a good clinical judgment to understand whether how much pain is actually this patient is feeling. Now coming to complex regional pain syndrome. It's basically a disorder of severe pain, swelling, and skin changes, and usually vasomotor instability and osteoporosis. Although these patients usually come off continuous chronic pain, especially this increased intolerance to coldness. This usually, even when you come to your clinic in let's say May or June, even still they would be covering their hands with multiple blankets because there is so much a high degree of intolerance to cold, because there is associated vasomotor instability as well. There's maybe associated previous history of MI, stroke, or hemiplegia in these patients. And usually, if they present with knee kind of a pain, then they may be associated with osteoporosis or osteoarthritis. Then we may require an arthroscopy to rule out whether it is actually some kind of a cartilage damage or some kind of osteoarthritis or chondromalacia which is actually affecting the joint, or is it just a nervous problem, or it is associated with complex regional pain syndrome. As the nerves are involved, this usually autonomic nerve dysfunction as well. This actually produces vasodilatation, leading to swelling, edema, and skin changes in kinds of erythema. And pain is due to neuropathy. So pathogenesis actually is not clear, but it's termed as it's kind of a type of a sympathetic overactivity. That is why it results in this kind of symptom. There is abnormal cytokine release, neurologic inflammation, and eventually classical presentation of swelling and sympathetic mediated enhancement of pain responses. This causes cortical reaction to nauseous symptoms. They may be so much intolerant to cold as well that they may be covering themselves in a lot of blankets as well, because they are highly intolerant to cold. Clinical features include burning pain and cold intolerance, tenderness and stiffness because they keep their usually joints immobilized due to pain. There may be local redness or cyanosis. Local redness could be due to autonomic dysfunction, which causes vasodilatation, or cyanosis could be due to the autonomic dysfunction, which causes vasoconstriction, and there may be pale blue peripheral hands and toes. There may be scanty hair and atrophic nails due to autonomic dysfunction and associated with osteoporosis of the bone and joint stiffness. And once they keep their joint in different positions due to decrease their intensity of pain, this may be in the long run associated with fixed flexion deformities or fixed joint deformities, eventually along presenting with this kind of symptoms. Treatment is symptomatic. Initially, we give anti-inflammatory drugs and physiotherapy, and steroid may be useful as well. Then calcium regulating drugs such as calcitonin may be good enough if this is associated with severe form of vasoconstriction. And lastly, the tricyclic antidepressants may also have to be given because they have usually associated psychological symptoms as well, leading to depression and all that. So the tricyclic antidepressant may be given to them to alleviate them of the psychological symptoms which may be associated with the disease. Classically, you said that you have to go through the physiotherapy of hot and cold bucket. That you dip your hand in one of the cold bottles first, and then move it, and then you dip the hand into the hot water first, and then move it. This kind of autonomic impulses actually results to decrease the level of pain being felt by the patient. Now coming to another disease called a syndrome of chronic pain. This is also classically, associated pain, depression, and somatic illnesses, associated weakness and paresthesias. There's no clear-cut etiology down there, but the patient is generally unwell, and you can feel that the patient is having multiple problems without really clear-cut underlying etiology of the problem. Management includes analgesics, anti-inflammatory to cure the patient of the pain. Maybe local steroid injections may be given if there is massive side of this. Classically, the problem is localized somewhere. Acupuncture may be helpful as it generally is a disease of multiple superficial neurons. Transcutaneous nerve stimulation may also be helpful in these patients, or maybe resulting in sympathetic kind of a block because autonomic dysfunction is usually associated with somatic and psychological symptoms. Although surgical rhizotomy is rarely done, but it can be an option if the pain is too intractable and it is not cured by any mechanism, then we may have to go for this kind of a procedure. But mainly the treatment is usually NSAIDs, psychosocial assessment and therapy, and behavioral modification, neuromodulators, so that they can be relieved of their symptoms. Now coming to the fibromyalgia, although it's a very rare disorder, but it's very common, especially in case of a female. Usually features widespread pain and tenderness. There may be multiple areas of tenderness, and usually, if you take the history of this kind of a patient, they say, I have a pain almost everywhere in the body. And usually, the first thing gets struck is there's no localization, almost all the joints are involved, and they're usually associated with depression, anxiety. There's maybe pain in all four quadrants of the head. They're associated with the classical migraines, but sometimes they complain that instead of having one side of the half of the head involved, there may be a whole of the head is involved as well. And headaches, these are all very common. Initially, when fibromyalgia diagnosis was made, it was actually 18 tender spots on the body were tested. But now it is usually without actually testing for each and every tender spots. Generally, this diagnosis is diagnosis of exclusion. Once all of the things are ruled out, usually the patient is labeled as suffering from fibromyalgia or tender spots. This may be abnormal sensory processing as well. They may be having a problem with certain stimuli, such as even the smell of something, which may be induce some kind of a event or kind of a pain and depression in them as well. Treatment is physiotherapy, analgesics. They may require low dose amitriptyline, gabapentin, and pregabalin are actually neuromodulators which may be enhanced and help them to relieve them of their symptoms and actually neuromodulate the function of the nerves. There may be associated with myofascial pain syndrome, which is palpable knots or cords in the trigger points, especially in the back. And this is the treatment option is usually physiotherapy, stretching exercises, and if this pain is so severe, NSAIDs can be given, but usually are not effective for in the long run. We have in this section we have gone through certain some manifestations which actually do not appear to be a true disease in a true sense as well, but chronic pain syndromes, especially associated with depression, anxiety, and multiple tender spots may be as well present. And sometimes the patient actually cannot localize the pain. He or she may complain that it is generalized pain everywhere, and we have to actually make the diagnosis whether this patient has chronic pain, regional pain syndrome, or is it fibromyalgia, or is it some kind of a underlying etiology is present and is actually associated with certain problem. Usually in these patients, a multidisciplinary approach is required, as these patients actually suffering not only from pain, the joints and contractures, but they are also associated anxiety and depression as well. So we just do not need to treat them medically to give them NSAIDs and neuromodulators, but we need a physiotherapist as well, which can give them exercises so that muscle stretching can be done. We need to have an orthotic specialist as well, so if they require any splint, that can also be given. And then we also need to involve behavioral therapist and psychologist as well, because underlying there is always some degree of anxiety and depression associated with these problems as well. Thank you very much. Keep watching sqadia.com.